Did you know there are over 8 million people in the UK with a long-term health condition that restricts their ability to work?
This doesn't mean that we don't want to work or that we're not trying hard enough. It means that there are very real physical and social barriers we face.
Our focus should be on breaking down these barriers rather than placing prejudice and blame on individuals.
It's time to change the narrative.
Some people with long-term health conditions aren't well enough to work at all, and they should never be forced into unsuitable roles.
But there are also many of us who want and who can work, and we're actively looking for accessible opportunities.
You tell us more disabled people need to be employed, but propose cuts to access to work, so we don't have the adjustments we need to do our jobs.
You tell us you'll improve employment support, but propose cuts to the social support that we rely on to live.
You tell us we belong in work, but the complete lack of nuance in these discussions is hurting millions of us already.
We have talents and skills that make us an asset to the workforce, but there are many barriers that we face in employment, and until we tackle those barriers, nothing can change.
There has never been a more important opportunity to change things for the better.
And we have to find a better way forward for future generations too.
So, instead of sanctioning people who happen to be disabled, here's what we want to see instead.
More flexible work options like remote working or reduced hours, so we can look after our health and protect our quality of life.
Better training on energy limiting conditions for employers and recruiters so they have more of an understanding about the barriers we face and how to combat them.
Nuance in conversations about who can and cannot work, and recognizing that long-term health conditions affect everybody differently.
A better understanding of workplace adjustments and improvements to the access to work system so that people are not left without the support that they require.
Investment in organisations and lived experience experts who support people with long-term health conditions and are most able to provide solutions.
Penalising disabled people and reducing their social support will not make them less disabled.
And it won't make the world of work more inclusive.
Now is the time to listen to our voices and work with us to change this narrative for good. Are you ready to join us?